it doesn't surprise me that it's not going faster.
Over the last 10 years, David Mahalik says he has drilled and studied pandemic plans, and he says what he's coordinating now looks nothing like what he prepared for.
It was supposed to be large venues, arenas, areas where you had plenty of space, areas where you could pre-register people en masse. So I can tell you at home to go to a website and it's a central registry.
As hospitals like his, Einstein Montgomery, continue to treat ER cases, cardiac patients, and deliver babies, the size and scope of getting shots in arms has been difficult. He says from limited vaccine to limited staff to make it happen, and then the process of getting folks signed up, registered, and tracking and reporting each dose back to the state takes time and manpower. If it's a big job for his hospital, down the road, the struggle's there too.
Because the vaccines are just one small part of resources that we require.
At Suburban Community Hospital, plans are being made for its first community vaccination event. Both hospitals say when it comes to reaching the general public, the math is tricky.
Do I want to order 1,000 and then hope they have 1,000 for me later on? Or I want to order 1,000 and make it 500 and 500? So that's more frequently why people have doses in fridges or freezers, because they're saving that for the second doses.
I received requests as far away as New York, Philadelphia, and others in New Jersey.
Schmidt says some of those calls are from people who got the first shot and then have learned they're on their own for that second dose.
Because right now we're not guaranteed further doses. Now, I don't see why we would not get further doses. But each dose we receive, we want earmark 50% for first, 50% for second.
Both health systems say they ask for the maximum they can get, but have gotten half of what's requested, causing them to split that shipment in half to make sure each person who gets a shot gets that needed second dose. Now, Suburban says it'll start taking appointments for its public vaccination once it finalizes plans for staffing and making changes to the interior of the hospital to accommodate all of those people. Also setting up a secure link on its website for those patient registrations, things that it has never had to do before. In Montgomery County, Deanna Durante, NBC10 News.